Attention Deficit Hyperactivity Disorder ADHD is a psychiatric condition. Look at this picture, shows that signs and symptoms, a detail going on. Introduction. Attention Deficit Hyperactivity Disorder is a neurodevelopmental disorder characterized by persistent patterns of inattention, hyperactivity, and impulsivity. It affects both children and adults, impacting academic performance, work efficiency, and social interactions. ADHD is one of the most common mental health disorder diagnosed in childhood, and its symptoms can persist into adulthood. Definition. ADHD is defined as chronic condition that includes attention difficulty, hyperactivity, and impulsiveness. The American Psychiatric Association defines it is the diagnostic and statistical manual of mental disorders as a disorder with symptoms that interfere with functioning or development. Etymology. The term attention deficit hyperactivity disorder originates from the Latin word attendere, to stretch toward or pay attention, and deficit, to fail or be lacking. Combined with hyper, over or excessive, and kinesis, movement, from Greek, reflecting the core symptoms of the inattention and hyperactivity. The disorder was previously known as minimal brain dysfunction and hyperkinetic reaction of childhood before being officially treated ADHD in the DSM 3 in 1980. Types. According to DSM 5, ADHD is characterized into three main types. 1. Predominantly inattentive presentation, difficulty sustaining attention, forgetfulness, lack of organization, and being easily distracted. 2. Predominantly hyperactive impulsive presentation, fidgeting, excessive talking, restlessness, and difficulty waiting for turns. 3. combined presentation, symptoms of both inattention and hyperactivity, impulsivity are equally present. Causes. The exact cause of ADHD is unknown, but several factors contribute to its development, including 1. Genetics. ADHD tend to turn in families. 2. Brain structure and function. Differences in brain activities, particularly in areas controlling attention and impulsive regulation. 3. Prenatal and perinatal factors. Exposure to alcohol, tobacco, drugs during pregnancy, premature birth, and low birth weight. 4. Environmental factors. Exposure to lead or other toxins, poor nutrition, or extreme stress during early childhood. Risk factors. Several risk factors increases the likelihood of developing ADHD. 1. Family history of ADHD, other mental health disorders. 2. Premature birth or low birth weight. 3. Exposure to environmental toxins, example lead. 3. Maternal smoking, alcohol use, or drug abuse during pregnancy. 4. Traumatic brain injury. Complications. If left untreated, ADHD can lead to 1. Poor academic and work performance. 2. Relationship difficulties. 3. Lack of self-esteem. 4. Increased risk of accidents and injuries. 5. Substance abuse. 6. Anxiety and depression. 7. Legal and financial problems. Pathophysiology. ADHD is associated with dysfunction in the prefrontal cortex, which is responsible for attention, impulse control, and executive functions. There is a deficit in dopamine and norepinephrine neurotransmitter activity, leading to impaired signaling in brain regions involved in behavior regulation. Pathophysiology of attention deficit hyperactivity disorder, step by step process. 1. Genetic and environmental influences. ADHD has a strong genetic basis with heritability estimates around 70 to 80 percentage. Environmental factors such as prenatal exposure to tobacco, alcohol, toxins may contribute to abnormal brain development. 2. Neurotransmitter dysfunction. The brain of individuals with ADHD shows deficient dopamine and norepinephrine activity which affects attention, impulse control, and executive functions. Dopamine is responsible for motivation and reward processing, while norepinephrine plays a role in alertness and attention regulation. 3. Impairment in the prefrontal cortex. The prefrontal cortex responsible for executive functions such as planning, decision making, and impulse control is underactive in ADHD individuals. Reduced blood flow and metabolism in the PFC leads to difficulties in maintaining attention and regulating behavior. 4. Dysfunction in brain networks. The difficult mode network DMN, which is active during rest and self referential thinking, remains overactive in ADHD, making it hard for individuals to stay focused. The pronatostratal circuit connecting the prefrontal cortex to the basal ganglia is impaired, leading to poor impulse control and hyperactivity. The dopaminergic reward pathway involving the ventral tegmental area VTA and nucleus accumbens in less responsive, making individuals with ADHD seek consistent stimulation. 5. Delayed brain maturation. Study shows that the cortical development in children with ADHD is delayed by 2 to 3 years, particularly in areas related to attention and self regulation. This delay contributes to difficulties in organization, emotional control, and impulse management. 6. Hyperactivity and impulsivity. Due to underactive inhibitory control centers, individuals with ADHD struggle to filter out distractions, leading to excess movements and impulsive actions. The imbalance between excitatory and inhibitory neural signals results in difficulty sitting still, waiting for turns, or resisting immediate gratification. 7. Cognitive and behavioral symptoms emerge. Inattention, difficulty sustaining focus, frequent day dreaming and forgetfulness. Next symptom, hyperactivity, executive talking, fidgeting and restlessness. Impulsivity, acting without thinking, interrupting conversation and poor risk assessment. 8. Long-term effects on behavior and functioning. If untreated, ADHD can lead to academic difficulties, emotional dysregulation, poor social skills, and increased risk of substance abuse. However, with medications, behavioral therapy, and environmental modifications, symptoms may be managed effectively. This step-by-step process explains how ADHD develops and affects brain function, leading to the characteristic symptoms of inattention, hyperactivity, and impulsivity. Signs and symptoms. ADHD symptoms vary depending on the type but generally include inattention symptoms. 1. Difficulty sustaining attention in tasks or activities. 2. Frequent careless mistakes in schoolwork or work. 3. Trouble organizing tasks and activities. 4. Easily distracted by external stimuli. 5. Forgetfulness in daily activities. Hyperactivity, impulsivity symptoms. 1. Consistent fidgeting or tapping hands, feet. 2. Excessive talking. 3. Difficulty remaining seated. 4. Interrupting conversation or activities. 5. Impatience in waiting for turns. A diagnosis, it is based on clinical evaluation using DSM-5 criteria. The process includes 1. A detailed medical and psychological history. 2. Standardized ADHD rating scales, example Vanderbilt Assessment Scale, Connors Rating Scale. 3. Reports from parents, teachers, or caregivers. 4. Rule out other medical conditions such as learning disabilities or anxiety disorders. Nursing diagnosis. 1. Impaired social interaction related to impulsive behavior. 2. Ineffective coping related to frustration and hyperactivity. 3. Risk for injury related to hyperactive and impulsive behavior. 4. Self-esteem disturbance related to academic difficulties. 5. Knowledge deficit related to ADHD management. Medical management. First, pharmacological treatment. 1. Stimulants, methyl phenidate, amphetamine. 2. Non-stimulants, atomoxetine, guanfacine. 3. Antidepressants, bupropions, venlafaxine. Next, behavioral therapies. 1. Parents training and behavior management strategies. 2. Cognitive behavioral therapy CBT. 3. Social skill training. Nursing management. 1. Encourage structured routines and organized environments. 2. Educate caregivers about ADHD and medication management. 3. Monitor medication side effects and effectiveness. 4. Assist in developing coping strategies and social skills. Treatment options. 1. Medication therapy, stimulants and non-stimulant medications. 2. Behavioral therapy, modifying behaviors through reinforcement techniques. 3. Counseling and psychotherapy, address emotional and psychological challenges. 4. Educational interventions, special education programs and classroom accommodations. 5. Lifestyle modifications, healthy diet, regular exercise, and good sleep hygiene. Psychosocial medicine. 1. Cognitive behavioral therapy helps in changing negative thought patterns and improving focus. 2. Patient training programs educates parents on managing destructive behaviors. 4. Social skill training helps children and adults develop better peer interactions. 5. School based interventions, classroom modifications, individualized education plans, and teachers training. 6. Mindfulness and relaxation techniques, yoga, meditation, and stress management strategies to enhance focus. Prevention. While ADHD cannot be entirely prevented, some measures can reduce the risk or severity. 1. Prenatal care, avoiding alcohol, drugs, and smoking during pregnancy. 2. Healthy lifestyle, encouraging a balanced diet, regular exercise, and adequate sleep. 3. Early intervention, identifying early symptoms and seeking timely medical guidance. 4. Reducing environmental risk, limiting exposure to toxins like lead. In conclusion, ADHD is a complex neurodevelopmental disorder that significantly affects individuals' daily lives. Early diagnosis, appropriate treatment, and supportive interventions can improve outcomes. A combination of medications, behavioral therapy, psychosocial interventions, and lifestyle modifications helps individuals with ADHD leads fulfilling lives. Increased awareness and education about ADHD can enhance understanding and reduce stigma, promoting better support for affected individuals and their families. Thank you. Have a nice day.